Assalamu alaikum.
Alaikum assalam wa rahmatullah.
How are you?
I'm fine, thank you.
First of all, I'd like to thank you for giving us your time.
My pleasure.
We know you're a busy man, and alhamdulillah, you've managed to give time for Imam Hussein.
Of course.
First, I'd like to ask your name.
Yes, my name is Dr. Basil Al-Mahdi.
Dr. Basil Al-Mahdi. And from your name, I understand your profession is probably
Yes.
a doctor of some sort.
Yes, I'm a doctor. I've graduated from medical school in 1997. Been practicing medicine for the past 12 and a half years. Did lots of branches of medicine, and then ended up being specialized in anesthesia, intensive care and chronic pain management.
Okay. Basically, what we want to ask is your personal opinion as to Azadari. We know it's a very widely performed action, and it ranges from the wearing of black to crying to the beating of chests, and also to striking one's back or head with a blade or a sword, which often than not leads to bloodshed. What is your personal opinion and professional opinion as to Azadari?
Okay. First, my personal opinion. I practice Azadari, and I've been practicing Azadari for years and years. But my personal opinion has developed with time. When I was young, and especially when I was brought up in Baghdad, the circumstances and the media was quite against everything that relates to Ahlul Bayt under the ruling of Saddam Hussein. And the education, even our families, suffered in educating us the right way towards our imams, towards our religion, towards our aqidah, because of the government forbiddenness of the Azadari in all its shapes and forms, from speeches to beating the chest to tatbir and slitting the head. They were all forbidden for years and years. Therefore, at those days, both my attachment to Ahlul Bayt, despite the thorough teaching that I had at home and lots of books that I've been through about Immat Ahlul Bayt, about Tashayyu', about the stories and the life stories of our Imams, it wasn't enough. I did not have the bond that I do have now with our Imams until I left Iraq and then came to UK. In UK, the freedom of speech and the freedom of actions that everybody's enjoy led to the Shia practice their own Azadari rituals or their Azadari's practices in the way they want. And being exposed to the Azadari in all shapes and forms, despite being 30 years old, it reformed my attachment to our Imams, my knowledge of Ahlul Bayt, my knowledge of the maqamat of Ahlul Bayt, in a way or another. It's kind of magic. I did not realize at first why I've changed that much positively to my understanding. But then with time, when I looked back at my days in UK, I realized that it was directly related to the Azadari in all its shapes and forms. It indirectly made me a better Muslim and a better Shia. Whether people accept that or no, but for me, for my understanding, that was the truth. So I think personally, to start with, that Azadari in all its shapes and forms has concorded my belief and my aqidah and my imams. And to me, that's a true statement. Now, on professional level, I know that being a doctor and being specialized, it gives me a responsibility to explain how Azadari is not the worst thing on earth to do. One thing I just want to address to start with. And that's not to say that Azadari is a bad thing or medically wrong thing to do, because I'm going to explain this in a minute. But we should not judge God and our Imams by the way of what's in it for me. So, for example, I know that there is some religious background to support Siyam, for example. There is medical background to support the benefits of Siyam, for example. But if I do Siyam for the sake of the benefits, of the medical benefits, then I'm doing the wrong thing. If there are lots of positive, let's say, attributes to Salah in my life and in my social life, I should not be doing Salah for that reason, because that will take all the ajr away from me. If we keep doing this, then when we hit the wall of jihad, when we hit the brick of sacrifices, why would we sacrifice then? Because what's in it for me? So if we keep saying that I would not do this unless science proof that it's beneficial for me, I will not Sawm unless I'm convinced by scientists that Siyam is good for my health. I will not do Azadari unless you convince me, or a doctor comes and convinces me that it's not bad for my health. Then I'm doing the wrong thing for the wrong reason. So what if it's harmful? If I'm doing the right thing for the right reason, so what if it's harmful for health? Although this is not true for Azadari, but I just want to push this idea forward and put it on the table. We should not do things just because there is a scientific medical base to prove its benefit. We're doing it for the Imam Hussein, and if we are doing it for that reason, then that's how it should be. Having said that, let's go back to my medical profession and try to explain what's the harmfulness of Azadari. I know there are lots of books written by many scholars talking about how Azadari is not that harmful and hasn't been shown to do any harm to anybody ever in the past few hundreds and hundreds of years that's been practiced. But I'll just talk about the scientific harmfulness of it. The worst thing, if you come to people and ask them what's the worst thing in Azadari in terms of harmfulness and medical harmfulness, they will say slitting the head or tatbir. And I'll just talk about this, because if the worst thing is not harmful, then the less harmful things are not harmful as well. So the slitting of the top of the head with a sword, basically I want to explain it to those who don't know anything about it. It's not using the sword to chop the head off, or to break the skull, or to do the most harm to yourself, because with a sword in your hand, you're doing it to yourself, and you cannot by any mean whatsoever do a harm to your head with your hand, whatever your aqidah was and whatever your devotion was and whatever your psychology was at that moment, because there is a reflex. You cannot hit yourself that hard on the head whatsoever. So all what we're doing is we're hitting the head with as smallest hit as ever, because that's what our body physiology and reflexes permits us to do. You cannot harm yourself or introduce pain to yourself more than a certain level, despite in the highest of the emotional arousals that comes with the Azadari or whatsoever. You cannot introduce harm to yourself more than a certain level, because that's God's reflex, protecting reflex that God's introduced to yourself. So all what you do is you hit your head with the sword to an extent that is painfully acceptable to your body. And that's a reflex. You cannot overcome this reflex. All what would that do is to slit the skin and the subcutaneous tissue, or the tissue under the skin, and you will not be able to reach the skull or introduce any damage to the skull, because this is scientific reflex. You cannot introduce such a big blow to your head to cause damage to the bony structure of the skull, and hence the deep important structures. So all what you do, whoever you are, whatever your motivation was, will be just to slit your head and cause linear scratches to the skin and the tissue under the skin, subcutaneous tissue. There are lots of small blood vessels in the skull, and there is what we call stagnant circulation in the skull. It will come to a useful stagnant circulation explanation. So the blood goes there, and because of the small blood vessels, it will wander around and sometimes get stagnant in some of these blood vessels, where old white cells get stuck and stay there for ages. So all what we do with Azadari is, with Tatbir, is that you slit the head and some blood will shed. It differs from person to person, to how much blood is there in his skull, how much blood is there in his system, what's his blood pressure, what's his circulation, and how or where exactly the sword has hit him. So there will be some variation in the amount of blood shedded. Now we come to that. What's wrong with losing some amount of blood annually, once a year? Well, scientifically, let's talk science, you are supposed to get rid of some of your blood every year by what we call vivisection, or by donating blood, or by giving blood, to stimulate your bone marrow to produce more and more. So that's one a solid scientific fact that supports losing some blood once a year in the Ashura. And we'll come back to the donation process as well. So in scientific facts, if you talk to a hematologist who's a doctor specialized in blood diseases, he will advise you that you should lose or give or donate 500 ml of blood, around 500 ml of blood, varies between ages and sex and medical conditions, every 6 months. So whatever you lose, and 500 ml of blood, if you get a 500 ml cup, which is something big, half a liter, half a big Pepsi bottle, and you pour it on your head, you will see the extent of what a 500 ml does. If you compare it to 500 ml of blood, it's an extensive amount for you to see. Someone who lost 500 ml means that he's totally almost soaked with blood. So that gives you an idea to what someone who's got some drops of blood that covers his face has lost. Few tens of mils. That's the average. Some people do lose 200 to 500 mils, and those are the extremes. But the usual is people losing few mils, 10, 20, up to 50 mils sometimes, but that's it. That's as far as it goes normally. And that is well below what you should give to stimulate healthy bone marrow to produce more blood. Now that's one thing. And if people argue against the science and the scientific basis of what we do, there is the religious basis, of course, of what you do. And this is a book of 4Imam Sadiq. It's the medical sciences of narrated by the Imam Ja'far Muhammad Sadiq alayhi salatu wassalam. And in it there's a section, a full section, that talks about al-hijama. Al-hijama is sort of a section that's been practiced from the days of Prophet Muhammad sallallahu alayhi wasallam, and being advised for many medical problems by the Prophet and the Imam sallallahu alayhi. And there are lots of ahadiths from Imam Ja'far ibn Muhammad al-Sadiq I just want to quote a couple of them direct from the book so that I won't be told that I'm talking rubbish or talking what I want to. عن حفص البختري عن أبي عبد الله جعفر بن محمد الصادق عليه السلام قال الدواء 4 الحجامة والحقنة والقيء والسعوط. عن يونس بن يعقوب قال سمعت أبا عبد الله عليه السلام يقول احتجم رسول الله صلى الله عليه وآله يوم الاثنين وأعطى الحجام برا. عن حماد بن عيسى عن من ذكره عن أبي عبد الله قال الحجامة يوم الاثنين من آخر النهار تسل الداء سلا من البدن. عن أبي سلمة وهو ابن سالم ابن مكرم عن أبي عبد الله عليه السلام قال, and this is quite interesting, I'll translate it after I read it in Arabic. الحجامة على الرأس شبر من طرف الأنف وفتر من بين الحاجبين وكان رسول الله صلى الله عليه وآله وسلم يسميها بالمنقذة. And this hadith is narrated in Bihar al-Anwar, the volume 59, page 112 and 113. And it states, in the translation in English is, Abi Salama says that Imam Ja'far ibn Muhammad al-Sadiq Abi Abdullah alayhi salatu wasalam says, the hijama, which is what I'm going to describe in a second, on the head, 1 or 25 centimeters, which is the width of an open hand, from the area between the two eyebrows, or from the top end of the nose. So it's one open hand, which we call it in Arabic shibr, which is around 25 centimeters, 25 centimeters. If you close the hand, then it's here. If you open the hand, then it's here. So it's anywhere between the top of the anterior or the front rim of the hair to the back of the head. So it's there. And that's what Rasulullah used to do. And that's what Rasulullah used to call, according to the hadith, al-munqila, the saver. So, according to Rasulullah, hitting the head, this area of the head, with a sword and causing the shed of blood is something quite positive, and he used to call it the savior. So, scientifically, there is a sound base for it. According to the Ahlul Bayt science and medicine, the medicine of Rasulullah sallallahu alaihi wasallam and Ahlul Bayt, it's scientifically beneficial. And now I'm going to go even deeper into the cytological basis of these signs. As I mentioned earlier, blood vessels are small in certain areas, and this is one of them. And when the blood vessels are small, the circulating white blood cells, which is part of the components of blood, which is slightly large in size, these get stuck in certain areas, and this is one of them. The other one is the top end of around the top end of the thoracic vertebrae, which is the upper back. This is another place, and the top of the neck. This is the third place. These places, the blood vessels are small, so the circulating blood gets stuck. The big white cells get stuck and close these blood vessels, and causes a stagnant of blood in that areas. These blood vessels, or let's say that blood that's not moving around, will not get to the filters of blood in the spleen or in the liver to get cleaned up and distracted. So these white cells are more prone to get infections, more prone to get cancers, more prone to get all of the aging side effects of blood or of whatever. So you've got something there that's not moving, and it's more prone to all the aging problems of the cells, and cell death and cell mutation. Everything happens in these cells. if you get rid of blood in these areas frequently, and that's what Rasulullah used to do with hijama. He used to frequently do hijama on his head and hijama on his back to get rid of the stagnant blood that stays there and be a source of lots of medical problems. Some of them we know and understand now, and some of them we don't. And only future will prove what even more of medical facts will be there to prove how beneficial the hijama is. People at the time of Nabi sallallahu alaihi wasallam did not have this cytological understanding of the human body, yet they practiced what the Rasulullah sallallahu alaihi wasallam told them to do, and only time proved that it was scientifically right thing. And that's what I'm trying to say. We should obey our Imams, obey our Rasul sallallahu alaihi wasallam without questioning and without needing Dr. Jones to prove to us, or William Harvey to come and tell us 1400 years later that there is two circulations, whereas Imam Ja'far ibn Muhammad Sadiq in this book tells us that there is two circulations and that blood goes through the lungs to get oxygenated. And that's the problem. We don't need the science to prove to us that what our Ummah told us and encouraged us about is right. Yet, it's from their rahmah and it's from their mercy, they prove to us that what we already obeyed them with was the right thing. So that's in a nutshell, the scientific benefit of Azadari, or of hitting the head with a sword. And to my knowledge, there hasn't been a single reported medical complication of Azadari. Yet, there's many complications, well reported, documented complication of Siyam. And I know many people in my family who are forbidden from Siyam by doctors. And I encourage this forbiddenness because it goes with what the Rasul ﷺ and what the Quran says, that ليس على وما على المريض حرج. And this goes as well to Azadari. If someone is unwell or has got medical problems that he fears Azadari will harm him, maybe he shouldn't do it. It's not a wajib. It's a mustahab for those who can, and for those who their body can withstand this loss of small amount of blood. That's the scientific explanation and the personal explanation.
Thank you very much. I myself personally have learned quite a lot from this, and it's strengthened my knowledge and my understanding of Azadari. So only I ask Imam Hussein to give you more edge and benefit from everything.
Thank you very much. I just want to mention one other thing. There is a book, I'm sorry that I couldn't find an English translation. I think there might be some English translations there, which is called من وهج العشق الحسيني by Abdul Halim al-Ghazzi. It's got a fantastically well-structured argument on all bases, on the scientific basis, on the argumental basis, on the Sharia basis of Azadari, and from where do we get our knowledge about it, and where did it start, and how to defend it, and how to prove that you're not doing the wrong thing when you're doing Azadari. You're just doing exactly the right thing to prove or improve your bond to Imam Hussein and to all them, including Sahib al-Asr al-Zaman salawatullahi wa salamu alayhi, Hujjat ibn al-Hasan. And I think this is a fantastic read to whoever can read Arabic, and if you can find an English translated version, it'll be quite beneficial.
Thank you very much
My
for your
pleasure.
time.
My pleasure.